step? So this is a great question. In general, if you have a Gleason 6, a low grade or very low risk or low risk prostate cancer, you generally don't need a CT scan or a bone scan because the odds of you having any disease outside the prostate is almost less than 1%. However, if you get into the intermediate to high grade, sometimes we'll order a CT scan or bone scan to look for lymph nodes, to look for any bone lesions that can suggest metastatic disease. The risk of that is very low, even if you have intermediate risk prostate cancer. It increases if your PSA is greater than 10 and your Gleason score is greater than 8. That's when we start worrying about whether there's spread anywhere outside of the body. And that's when we would definitely order a CT scan and bone scan on you. In general, as surgeons, we sometimes tend to order these tests anyways, just because we want to know the anatomy. You know, we want to make sure you don't have an iliac aneurysm. We want to make sure there's nothing in the pelvis that could hinder surgery. And so we would probably order that just to get a scan of what's going on, so we're not surprised when we go in there and see something that shouldn't be there. So, and recently, when we see that, some surgeons might order an MRI scan of the prostate because there's been some new technology with MRIs where they can actually sort of map where your tumor is. The only way that helps us is that we can maybe tell you, well, listen, this tumor or this lesion is right at the edge. I may not be able to spare the nerves on that side, or if they don't come off easy, I'm not going to try to spare those nerves because I don't want to risk having a positive margin in that area. So that's where that may help in terms of counseling. But in general, I don't think it would help the actual surgical procedure per se, in terms of, you know, whether we would be able to get it all or not, because we have certain technical aspects in the surgery which we can't deviate from. So.